Good afternoon, and thank you for joining me today. My name is Neda Assi, and I'm honored to present my Doctor of Nursing Practice scholarly project titled Improving Opioid Education and Reducing Opioid Misuse in Total Knee and Hip Arthroplasty Patients. I would like to begin by taking a moment to acknowledge my committee. Dr. Robin Hendricks, my chair, whose guidance, expertise, and unwavering support were instrumental throughout the development and completion of this project, as well as my second reader, Dr. Marilyn Riley, for her thoughtful feedback and commitment to strengthening my work, and finally, my community partner and joint replacement class educator, Nurse Nikki George, whose collaboration and dedication were key in shaping this project and making it possible within the clinical setting. The rise in opioid misuse and risks and complications observed in relation to postoperative opioid use remains a prominent public health concern, with a reported 80,000 deaths related to opioid overdose in 2022. Additionally, studies have shown up to 10% greater persistent use among opioid-naive patients specifically undergoing orthopedic surgeries, such as hip and knee replacements. Despite the practice of regularly prescribing opioids among orthopedic populations, the need to understand safe opioid use, overdose risks, and proper disposal practice is commonly insufficient and ineffective. National guidelines recognize this and highlight the necessity to properly educate patients, implement multimodal pain management, and standardize the OUD risk assessment to prevent avoidable harm. Despite recommendations, many healthcare organizations struggle to establish consistent, evidence-based methods of educating patients preoperatively on safe opioid use and implementing effective OUD risk screening by medical staff. Inconsistent preoperative opioid education and screening tools created gaps in patient knowledge and nursing practice at the project site. Prior to surgery, total hip and knee replacement patients received general preoperative information in a mandatory joint replacement class with the goal of improving patient preparedness for what to expect the day of surgery and necessary appointments in assistive devices associated with recovery. However, education concentrated on safe opioid use was not standardized. Additionally, perioperative nurses expressed a lack of confidence in adequately assessing OUD risk and discussing safe opioid use with patients. Collectively, these gaps increase the risk for poor patient knowledge, unreliable screening methods, and potential postoperative complications related to misguided opioid use. The need to establish a structured, evidence-based intervention was reinforced via literature that emphasized the ability of brief educational videos to substantially improve patient knowledge and engagement, and the ability of standardized screening tools such as the DSM-5 OUD risk screening tool to deepen clinical reasoning and effectively and preemptively identify risks. This project was designed to address these gaps by way of integration of a brief, safe opioid educational video and implementation of a standard OUD risk screening tool within clinical workflow. Evidence-based practice and literature strongly support the use of structured opioid education and standardized OUD risk screening among surgical populations. The book questionnaire utilized in this project is validated through psychometric testing as a reliable means of quantifying patient knowledge regarding opioid overdose and overall safe opioid practices. Furthermore, studies demonstrate a significant impact on patient comprehension, retention of opioid safety information, and improvement of self-management through targeted educational interventions, namely video-based methods in comparison to traditional written and verbal instruction. The DSM-5 OUD risk screening tool is revered as the gold standard for identifying use disorder and has proven to be a reliable and valid tool across various clinical settings. Integrated standardized screening and perioperative clinical workflow aligns with the national recommendations for identifying patients who present a risk for opioid misuse early. Evidence-based practice and literature also highlight the need for multimodal pain management and engaging patients early on regarding proper opioid use and risks to ensure safe postoperative care. Additionally, the literature underlines the need for standardized education, assessment, and clear communication among orthopedic populations in order to decrease the rate of harm related to opioids and in turn improve post-operative outcomes. The post-operative nurse survey was founded on evidence-based principles and reviewed for validity. Altogether, the literature provides reasonable grounds for the implementation of a video-based opioid education intervention and DSM-5 OUD risk screening to improve patient knowledge and safer opioid practice in the perioperative setting. This project was guided by the health belief model, which is commonly used to explain and predict health behaviors. The opioid education video addressed perceived susceptibility by explaining overdose risks, perceived severity by highlighting consequences of misuse, perceived benefits by teaching safe opioid practices, cues to action through clear instructions and examples, and self-efficacy by empowering patients with knowledge. The DSM-5 screening tool also served as a cue to action for nurses, prompting consistent assessment and early identification of risk. The purpose of this quality improvement project was to assess whether a brief video-based opioid education intervention combined with standardized OUD risk screening would improve patient opioid safety knowledge and support safer postoperative pain management in total hip and knee replacement patients. The project utilized a quantitative confirmatory pre-post intervention design to evaluate the effects of implementing a video-based opioid education and standardized OUD risk screening tool prior to total hip and knee replacement surgery. The setting for the project was a Midwestern hospital, and more specifically, the A1 perioperative unit and the demonstration kitchen where the mandatory joint replacement class took place. Participants included 53 adult patients undergoing total knee or hip arthroplasty and 20 perioperative nurses who performed the preoperative screening and completed a postoperative pain management survey. The intervention was comprised of a 5-minute opioid education video that was played for patients in the mandatory joint replacement class after the initial book questionnaire, which was then followed by the same questionnaire upon completion, and the implementation of the DSM-5 OUD risk screening tool and postoperative nurse survey within clinical workflow. Perioperative nurses received standardized training on DSM-5 criteria, which included role play, neutral language practice, and documentation guidance to ensure accurate and consistent screening. 3 validated instruments utilized in this project included the book questionnaire, the DSM-5 OUD risk screening tool, and the postoperative nurse evaluation survey. The nurse evaluation survey included structured items assessing pain management strategies, patient responsiveness to treatment, and alignment with multimodal pain control principles. Survey responses were analyzed descriptively to distinguish patterns in nursing judgment and postoperative pain management practice. All evidence-based instruments were paper-based, anonymous, and incorporated into clinical workflows to avoid disruptions. The data was collected prospectively over the course of 9 weeks. The community member and ortho clinical coordinator collected completed instruments and stored them securely. The principal investigator then retrieved the data and manually transcribed it into an Excel spreadsheet to later analyze with SPSS. The sample included in this project were a total of 53 adult patients undergoing total knee or hip arthroplasty, along with 20 perioperative nurses who completed the DSM-5 screening and postoperative survey. You'll notice that demographic data was not collected, and I want to take a moment to explain that this was an intentional and strategic decision, not an oversight. Collecting demographic variables such as age, race, or ethnicity would have required a more extensive IRB process and additional layers of patient data protection that were not feasible within the project's time constraints. More importantly, avoiding demographic collection helped protect patient privacy and allowed for the project to remain fully anonymous and workflow friendly. But beyond logistics, this decision also served a conceptual purpose. One of the goals of the project was to demonstrate that brief, video-based opioid education is effective across diverse patient populations, regardless of literacy level, age, or background. Traditional written handouts can be overwhelming, inaccessible, or simply ignored, especially for patients with lower health literacy or those who feel intimidated by dense printed materials. By contrast, video-based education is inherently more inclusive, engaging, and easier to understand. So, by not stratifying outcomes by demographic variables, the project actually underscores a key point. The intervention's effectiveness does not depend on who the patient is. It works broadly, equitably, and consistently. This creates a strong foundation for future expansion, where demographic analysis could be added later to explore subgroup differences, if needed, but without compromising the core message of accessibility and universal benefit. Data analysis began with descriptive statistics to summarize book scores and survey responses. Normality was assessed using the Kolmogorov, Smirnov, and Shapiro-Wilk tests, which confirmed that the data was non-normal. Because the data was paired and non-normal, the Wilcoxon-signed rank test was the most appropriate statistical method to evaluate pre- and post-intervention differences. All data was manually transcribed into Excel and analyzed using SPSS, or Statistical Package for Social Sciences software program. The results of this quality improvement project established a statistically significant improvement in patient opioid safety knowledge after implementing a brief, video-based opioid education intervention. Pre-intervention book scores were lower, demonstrating a lower baseline understanding of safe opioid use, with a mean of 5.85 and a median of 6, compared to the post-intervention book scores, which demonstrated a notable increase, with a mean of 8.98 and a median of 10. The marked improvement was confirmed via the Wilcoxon signed rank tests with p less than 0.001, which indicated that the intervention successfully produced a significant, non-random enhancement of patient comprehension of safe opioid use and risks. Additionally, consistency in knowledge among participants after viewing the opioid education video increased, evidenced by a narrowed interquartile range from 4 to 2. The qualitative findings were supported by the quantitative findings, as perioperative nurses reported increased confidence discussing opioid risks and applying the DSM-5 OUD criteria to assess patient risk, further reinforcing the value of standardized screening tools and bolstering sound clinical decision-making. Patients were more engaged during the joint replacement class per the community member, asking informed questions regarding postoperative pain management and proper opioid use. Notable observations validated the evidence that video-based education improves patient engagement, comprehension, and self-management. Collectively, the results of the project validate the effectiveness of the intervention in addressing the practice gap in preoperative opioid education and OUD risk assessment in total hip and knee replacement patients. Despite the effectiveness of the intervention of improving patient knowledge and nurses demonstrating stronger clinical judgment, as well as proving video-based education is feasible, scalable, and cost-effective, this project had several limitations. The short duration limited the ability to assess long-term retention or postoperative outcomes. Demographic data was not collected, which restricts subgroup analysis. Additionally, the project was implemented at a single site, which may limit generalizability. Qualitative findings aligned with the quantitative findings demonstrated through nurse feedback. Perioperative nurses reported increased confidence applying the DSM-5 criteria and discussing opioid risks with patients, reinforcing the value of standardized screening tools in promoting sound clinical decision-making. Additionally, patients were more engaged during the joint replacement class per the community member, asking informed questions regarding postoperative pain management and proper opioid use. Noted observations validated the evidence that video-based education improves patient engagement, comprehension, and self-management. Collectively, the results of this project reinforce the literature validating the effectiveness of the intervention in addressing the practice gap in preoperative opioid education and OUD risk assessment in total hip and knee replacement patients. showing that standardized screening tools improve both clinical judgment and early identification of misuse risk. The findings of this project demonstrate that a brief, structured opioid education video can significantly improve patient knowledge and engagement. Nurses also benefited from standardized screening, reporting increased confidence and improved communication. These results align with national recommendations, emphasizing early identification for opioid misuse risk and standardized patient education. The intervention was cost-effective, easy to implement, and highly scalable across other surgical populations. This QI project emphasizes the crucial role that nurses play in patient education, opioid safety, and early identification of increased risk for OUD. By applying tools such as the standardized DSM-5 OUD risk screening, as well as evidence-based educational strategies, nurses are able to demonstrate improved clinical judgment, effectively reduce variabilities in OUD risk assessments, and in turn, improve patient safety. The video-based intervention successfully addresses the diverse learning needs and health literacy among patients, ensuring equitable access to clear, comprehensible opioid safety information. Nurse communication is a significant factor in the level of patient engagement observed, with patients displaying improvement in informed questioning and overall participation in the joint replacement class. The intervention reaffirms the role nurses play, illustrating the need for nurses to advocate safer opioid practices, multimodal pain management interventions, and a necessary shift in organizational culture towards evidence-based, patient-centered care. By implementing standardized education and screening, consistency is ensured, in turn, reducing bias and improving communication through patient care. In conclusion, this QI project underlines the significant impact that nurses have on improving postoperative patient outcomes, rates of opioid-related harm, and accessibility to high-quality, equitable care. This project has significant implications for organizational practice, workflow efficiency, and long-term patient safety. The intervention was cost-effective, requiring minimal resources, no additional staffing was needed, and the intervention was incorporated into pre-existing joint replacement class, reducing interruptions to perioperative workflow. The brief educational video is both time-efficient, easily replicable, and inexpensive, making it an ideal tool to improve patient knowledge. Due to its standardization, the opioid education video intervention decreased inconsistency in patient understanding, a necessary feature to ensure equitable and safe postoperative opioid knowledge. On an organizational level, the QI project highlights the need for overall improvements in patient safety, including a decrease in postoperative opioid misuse, improvement in pain management, communication among patient and staff, and enhanced patient engagement with their care. Perioperative nurses reported enhanced confidence when applying DSM-5 OUD criteria in alignment with national recommendations, which call for standardized OUD risk screening in order to identify risk early in patients and ensure safer prescribing practices supporting their safety around opioid use. Unsurprisingly, the orthopedic unit showed interest in permanently including the video in the mandatory joint replacement class, displaying strong stakeholder support and future sustainability of the intervention. Due to the results yielded by this QI project, as demonstrated via bar graph, scatter plot, and pie chart, there are several recommendations to support sustainability, scalability, and continuous improvement. First, permanent integration of the opioid education video into the mandatory joint replacement class, as it has proven effective, cost-efficient, and offers minimal disruption to clinical workflow. Second, continued use of the DSM-5 OUD risk screening tool among orthopedic patients, and consideration for its use across all perioperative populations, as it has proven an effective and standardized method to early detection of patients at risk for opioid misuse. The intervention demonstrates a promising potential for scalability, as standardized opioid education and OUD risk screening are relevant to all surgical specialties. Applying the intervention among other perioperative populations would further strengthen the organization's opioid safety practices. By featuring the video in the patient portal, accessibility would be further enhanced, as it would allow patients to revisit the information and allow involved caregivers to be involved on safe opioid misuse and informed. Limitations are the short duration, lack of demographic data, and the absence of long-term follow-up that clearly demonstrates patients' information retention and accounts for post-operative opioid-related outcomes. However, these limitations do not diminish the clinical significance of the visible improvements observed. This project reinforces the critical role nurses play in opioid safety. By applying standardized tools and evidence-based education, nurses can reduce variability in assessments, improve patient engagement, and support safer post-operative pain management. The video-based intervention also supports health literacy and ensures equitable access to clear, consistent information. In conclusion, this project successfully improved patient opioid safety knowledge and strengthened nursing practice through standardized screening. Future work should include long-term follow-up, larger sample sizes, and the integration of video into the patient portal to enhance accessibility. The intervention is sustainable, low cost, and highly scalable across perioperative settings. On a personal note, this project and the DNP program as a whole has profoundly shaped my clinical reasoning, leadership skills, and commitment to evidence-based practice. I'm grateful for the opportunity to contribute meaningful work to patient safety and nursing practice, and look forward to continuing to do so as a future doctor of nursing practice. These are the references that informed and supported this project and were utilized in this presentation. Thank you for your time.